And welcome back. Well, today I have a gentleman who's been on with us before, and Dr. Mark Gown is here today. Nice to see you again. You are a plastic and reconstructive surgeon with Finesse Plastic Surgery, so it's good to have you here.
Thank you. Thank you very much.
First of all, tell me just sort of nowadays in plastic surgery, I don't even know how long that term goes back, probably 50 years almost. How is the advancements changed? What would you say some of the most primary things today compared to even 10, 20 years ago?
Sure. Plastic surgery, how long has it been around? Thousands of years, not just 50. But in terms of what's new in the last decade or so,
yeah,
I'll start with facial plastic surgery, because we take care of face, body, and breast. But in facial plastic surgery, the hot topic now is adding back some volume. And we do that through fat grafting.
Okay.
So it's not just pulling skin back, let's say, for instance, for a facelift, it's actually volumizing.
Oh, that makes sense.
Not taking away the volume, which adds to a more youthful profile, youthful contour. So whereas even in, let's say, eyelid surgery, surgery of 10 years ago was removing skin, removing a lot of the fat, it ended up hollowing folks out, making them look a little bit older. So now we take less of that tissue, we actually add tissue back by doing some liposuction from another area and transferring that fat in little micro aliquots and blending it back in to add more volume to the face. So when you're lifting, you're also volumizing to give that youthful contour, which is a lot different of a concept from before, where we were mostly taking away.
Right, yeah.
And doing things that would provide an anti-gravity effect to lift loose skin. Now we're not only using that iron to lift that loose skin, but we're volumizing to add to a more youthful look.
Yeah, and I think it probably looks more natural.
Absolutely,
as well.
absolutely.
It used to be that if somebody just had the skin lifting or whatever whatever the procedure it was, you could kind of tell.
And that's the exact idea. So at Finesse Plastic Surgery, we're not aiming to achieve this overdone look. It's going to be very natural. You're going to look refreshed and relaxed. It's never that people will look and say, wow, you've had plastic surgery.
Yeah.
They're going to say, what have you done? Have you come back from that nice vacation? You look rested, and what's your secret?
That makes sense. We certainly have seen celebrities over the years where you're like, whoa, what happened to them? And that's nice to see that it's sort of changing. What about non-surgical procedures? If somebody doesn't want to have something major done, are there little things that could be done non-surgically?
The same way where we add volume during surgery, we can also add volume with the use of fillers. And so fillers can help minimize the creases that develop in the face. It can lift the cheeks by adding volume into the cheeks, and these are substances that are injected. They're not permanent like fat is, but certainly they give a temporary result that lasts several months, sometimes greater than a year, and can improve the profile, improve the contour, and also be a very youthful result.
Okay.
So other than the fillers, we have injectables. They're called neurotoxin. Everybody's heard about Botox. That's going to block the action of muscles in the face to prevent the face from creating those creases that give an angry look, or injections can be done around the eyes to lift the brows to add to a more wide awake, more refreshed look as well.
Let me ask you about that. It's just a question that I've always had. I know you hear this from folks when they hear Botox, of course, has been around for a long time now. But on one hand, where you talk about neurotoxins, and we know the origin of Botox, that it's a toxin in some realms, how does it turn into something positive in plastic surgery?
The way that works, it's a very localized effect. It's injected into the muscle and blocks the action of the muscle where it's injected.
Okay.
So it's not that it's poisoning the body, it's blocking the action of the muscle so they can no longer contract. And it's also a temporary result. So the muscle will recover, it'll recreate those receptors that are being blocked, and about 3 to 4 months' time, you get back to baseline.
Okay. What is the age range that you work on nowadays? What is has it expanded compared to years ago?
We have all ages, and it has expanded because people are living longer and healthier lives. And so patients sometimes in their 80s are healthy enough that you wouldn't think that age has even gotten them.
Yeah.
Okay? They're just as vivacious as they were 20 years before.
Speaking of age, we all age differently. Are some people it seems that as they get older and maybe they've never had any work done, they still look youthful. Just like the rest of our body, do our genetics have to do with how our skin ages and how we look overall at one age compared to someone else?
Genetics plays a big component, but that doesn't mean that proper skin care, touch-up procedures, volumizers are not going to help. The idea is, in the past, patients used to come and say, I want a facelift. Is this going to last? How long is this going to last me? And the answer was it'll last you 10 to 12 years. But that's not entirely true. It's going to last you a lifetime. Imagine two identical twins, sisters.
Right.
Okay, one gets facial rejuvenation surgery, one doesn't. Well, the one that's had the surgery is always going to be 10 years ahead of the one that hasn't.
Well, that's
so
true.
It's irreversibly setting the clock back.
Yeah, interesting. And how do you, a patient sits down with you, how do you consult with them to the point that they are going to understand what the outcome is going to be, how they visualize that?
So we talk about before pictures, we go over that, we draw on the pictures, we show what can be done, we go through various other patients before and after results, and we also have computer imaging.
Okay.
So computer imaging has come a long way as well. It's no longer just two-dimensional. When I talk about things like structural fat grafting, we're talking about three-dimensional changes.
Right.
So we have software where the patient sits down and we take a three-dimensional view of their face, and we can show a possible result. We can show where we're placing volume and what they can expect with the surgery. So it's a nice preview of what can be done.
Okay. Are in some cases cover any of this type of surgery covered by insurance if it's more of a medical need rather than a cosmetic need?
Some of it is, and one example in particular is something called ptosis, and that's lowering of the eyelid. So
really?
if the eyelid skin or the level of the eyelid is down and impinging upon the patient's vision,
okay.
so it's covering up a portion of the pupil, so they have to lift their head up to read, they have to look up like this to look at street signs or street lights. Then that portion of the procedure, which is done to correct that length of the eyelid, is covered by insurance. But the extra skin removal, the fat placement back into the temples and around the upper hollows of the eyelid, that portion of it is cosmetic.
Okay.
So we do work with a lot of combined cases in which we'll perform a reconstructive surgery in conjunction with an aesthetic surgery to improve cosmesis as well.
All right, very good. How does one go about coming in and sitting down with you and just talking about things that they might want to change about themselves?
Absolutely. You can find us on the web, www.finesseplasticsurgery.com, or
Okay.
call our main number and set up a consultation. Consultations are free.
Okay, and the number is 949-770-0797. And if maybe there's something you want to change about yourself, I can see that Dr. Gowan can help you. And are there times that people might sit down with you where there's something very extreme they want done, and are you able to look at them and say, you know what, this is what we can do? It might take several procedures over time, or no.
It's all about management of expectations.
Yeah,
so
exactly.
if a patient has unrealistic expectations, I'm not going to say you're the best surgical candidate.
Right. So you're very honest with them and upfront.
Absolutely. You have to lay down the foundation. It's all about endearing trust between you and the patients.
Yeah.
Today's realm, with the medical spa industry the way it is, they're treating these patients as customers. Well, to me, they're not.
Yeah.
They're my patients, and I'm going to tell them what they need and how to get there. I'm not going to force them into anything just because it's the hot thing to do in the magazines and in televisions today.
All right, very good. Nice to see you again.
Good to see you again.
And again, Finesse Plastic Surgery, you can go online right there, the same verbiage, finesseplasticsurgery.com. And if you want to set up a consult with Dr. Gowan here, you certainly can, 949-770-0797. We'll be right back.